is that the antigen tests would serve significant benefit to those who may feel they have symptoms, particularly in the season of the flu, and require a test with those symptoms to determine whether it's COVID or the flu. I'm giving an example. And it would easily rule out those persons who may have symptoms, but it's not COVID, because the results turn up more so when you are symptomatic. Is that what you're saying? If it's COVID and you're symptomatic, then the results are showing 100% accuracy, or you'd say as close to that as possible. It's when you're not symptomatic, you may feel that you have come in contact with someone, but you have no symptoms. It will pick you up to 80% of the time. Is that what you're saying?
What we are saying is that, especially now, part of the accuracy of the test is going to be dependent upon how many persons actually have the COVID-19. And so the accuracy will depend upon the number of persons who are symptomatic and have COVID-19. Now, one of the reasons why we do validation tests and we monitor very carefully and we use our PCR tests to confirm or to double check our results is that we want to find out in our local setting how this kit performs. Yes, if you are symptomatic, we know that from other studies, we should pick you up if you have been positive for COVID-19. But then understand that if you are symptomatic and you are negative, we still want to make sure that this is not now a new phenomenon, that we are missing some positive cases. We want to be sure that you don't have COVID-19. So we'll still be investigating. We expect you to be positive if you have COVID-19. But while we are using the test in Jamaica for the first time, we are going to be doing PCR to check some of the positives, some of the negatives, just to ensure that what we are getting is going to give us the most reliable results. So one of the things we want you to understand, this is why we need the private labs to work very closely with us, because it's not just a test, but especially in the early stages, the interpretation of the test is going to be key.
Thank you.
Thanks very much, Dr. Hamilton. I'm going to go to Debbie Ann Wright.
Good evening. I know that the ministry sends out information regarding recoveries, but have we had any patient who is considered critically ill or who have had to be placed on ventilators recover?
Ross.
The question,
Are you hearing me?
the question is whether anyone placed on a ventilator has recovered. This is a COVID patient, you mean?
Or anyone who is critically ill?
Anyone critically ill?
Right, any COVID.
Okay, let me ask the clinicians to respond to that.
Yes, we have had critically ill persons that have recovered, and I must say that I think in our next press conference, Minister, we will speak a little bit more on this in terms of giving the details, because we have identified at the ministry that this is a question that the public is interested in. So we're gathering the data on our moderately ill and critically ill persons, and I think that we will commit to doing a presentation on this in our next press conference. But yes, persons that have been critically ill have recovered, and persons that have been on ventilators have recovered.
Thank you. Stephen?
Thanks. I'm going to have two follow-up questions, one from Jamaica Social and one from Brittany. So go to Jamaica Social quickly.
One quick question regarding discharge testing. This is to the CMO. I recall, I believe last press conference or the one before, you said that you were moving away from doing discharge testing because at some point in the recovery, I mean, what you see are just literally fragments or remains of the virus, and it doesn't really tell the true picture about recovery. As normal, as far as you're concerned, after 10 to 14 days, that person, as the gold standard is, should be recovered for the most part. I noticed that in the report that comes out, I'm still seeing some small numbers of discharge testing. Is it that you are getting to a point when you're going to be going full everybody after 14 days, or you're still going to be doing discharge testing? Or at what point do you stop doing discharge testing? Thanks.
We have in fact, from a policy guideline that have been sent out from the ministry, changed our protocols, and so we do not do discharge testing except for the critically ill persons who would have been critically ill in hospital. Then we would do discharge testing on those persons. So there's a small subset of persons that we do some discharge testing on. However, I do believe that some of the cases that you're actually seeing being recorded, we may have persons in the field that are still doing some discharge testing, but that is not the protocol for the Ministry of Health and Wellness at this time. We have moved away from that for some time now, following in keeping with the guidelines from the World Health Organization. But the critically ill persons, you will see discharge testing for those persons.
Thank you very much. And it's the final one from Brittany.
Okay, just a follow. Well, my second question wasn't answered earlier. It was, are patients who do COVID-19 tests with private facilities accounted for in the ministry's daily update? And my other question was, has there been any discussion or progress made with insurance companies to assist COVID-19 patients? Thank you.
In terms of our guidelines for private laboratories that have been put out for persons who would want to do private testing, a part of the guideline is that they are required to report. Now, no, we have not so far have any private lab that have been approved by the Ministry of Health. We are aware that persons are doing testing using other certifications that they would have from other organizations. But as an approved Ministry of Health and Wellness center, we have not had any approvals completed. Some persons are still in process of doing that. But a part of the guideline, and I would encourage all laboratories, whether or if you are doing testing, then you really need to report. And we will be making steps over the next 2 weeks to put in the measures to ensure that there is compliance, some measure of compliance. We recognize that we have not been getting the required reports from some laboratories, and we would be putting in measures over the next 2 weeks. So laboratories need to look out for this, because they may not be in the right if they are doing testing and they are not reporting.
Thank you very much, CMO. We'll just go to Minister to bring his closing remarks.
All right, thank you very much. Well, in response to that question about insurance and progress, Brittany, I know the Ministry of Tourism, the Minister of Tourism and his team are looking at an insurance policy around visitors coming in, and they are close, based on what I've heard from them and from him, to an option that persons visiting the island can exercise that would allow a number of benefits, including airlifting back to their country of origin. I'll allow him to speak more on that, but it is in the making, to put it sort of simplistically. I can't say about insurance companies generally in the population and the locals, because I really don't know, to be totally frank. I would have to check on that to see. Of course, the best insurance you have at this point is to go to a public health institution, whether a hospital or health center, and that is already paid for. and we work hard each day to give as much support, and we get about 3 million visits a year to both health centers and hospitals, and I think the team does a good job. So that option is always there. So in closing, ladies and gentlemen, I want to thank you for staying with us this evening in our COVID conversations. We, as promised, tried to offer a slight variation from what normally is the case. Did not spend much time on announcing the numbers. You can visit the Ministry of Health's website to get the numbers. We did commit, and we have tried to live true to that, at 10 a.m. each day. The numbers are uploaded, so you get the last 24 hours numbers, deaths, hospitalization, positive cases, tests, and all the information that used to be distributed. I do take note that we have had some feedback on social media, persons asking for the updates in the traditional form, and I've been on the receiving end of some of the criticisms for not giving the regular precursor to the numbers and then the numbers. You know, I fully appreciate and understand why persons would want it that way, and you know, we will discuss it and we will look at it internally. But I want persons to also appreciate why we chose to go the other way. I mean, there were some who criticized the uploading from my pages, for example. Others have now said it should continue. So, you know, you get mixed views. I do appreciate those who have encouraged the continuation, and I thank them for you know, that kind of encouragement. However, one, we really want to shift the focus in this phase of the pandemic, where we are now having community transmission, less on positive cases, which are important. We really are trying to make or minimize the positive cases. But in this phase, we're going to get a lot more. And it's important that Jamaicans understand that, because it's everywhere. And we have to go through that phase. And we did say over the next 2 to 3 months, we're going to see that. If we focus solely on that, or primarily on that, we run the risks of not focusing on the measures that are important, the individual responsibility that is critical to living with COVID and overcoming COVID. So it's really about what are the precautions we need to take, what are the new protocols that we need to adhere to and practice, how do we access the hospital system, you know, how do we protect the vulnerable, how do we operate in the workspace. Those for us represents currently the most important elements of the COVID response. And what I would like to do in the months to come is to update, whether from my pages or from the ministry's pages or anyone else, the information around coping with, living with, and overcoming COVID. That to my mind is the encouragement that the population needs, the leadership it needs. And it's not that we're hiding the numbers of positives, but frankly speaking, the overwhelming majority of positives are going to recover. We have to help persons to avoid it or recover from it, while we give critical support to those who are most vulnerable. So while we will review constantly and update and adjust as necessary, I just want to say why that decision was taken. Thank you very much for joining us today. We had a good discussion, I think. The antigen test is now here. You want to say something? The antigen test is now here. I know it's long overdue. We have asked, well, it's coming. So we have announced in the weeks to come. We're doing some preliminary work now. It will be available across the country once you subscribe to the protocol involved, the training, but also the reporting mechanism. And we will lead that charge. The workplace protocol will be out soon. A draft has been circulated. I intend to be out in the field to visit with employers, employees, to help to push the agenda of the workplace protocol and individual responsibility. The tourism interests will likely see some relief as it relates to pre-testing. That is being assessed, but it looks encouraging. But again, that's not my decision solely. It's a decision by the cabinet influenced by the advice. And of course, finally, but of course not in any way less of the important information today, I want to welcome the Minister, our new Minister, Cuthbert Flynn, for joining us and for being a part of the team. Thank you very much, and we will continue the conversations in the days to come. Please help us with that conversation by encouraging others to subscribe to the protocols that we are promoting. Thank you. God bless.